that my very own fertility doctor is here. Before we get started, this is not medical advice. Please make sure you consult your own doctor, before you take any action on anything. We are just here today to talk about the COVID vaccine and fertility. So introduce yourself.
Hi, everyone. I am Dr. Jenny Nichols. I am with Sincera Reproductive Medicine. This is probably the hottest topic, and I am talking about it with every single patient, every new fertility patient, every talk patient, every patient in the office, because it is, well, heck, I'm talking about it with my parents, I'm talking about it with friends, I'm talking about it with teacher friends who are calling and asking what they should do, whether they want to get pregnant, whether they are not wanting to get pregnant, because it's on everyone's mind. But obviously, people who want to get pregnant, it's a huge deal. People who are pregnant, it's a huge deal because coronavirus, it has been here for, as scary as it is, a year. The first patient who was diagnosed in the United States has been over a year, and we've all been living with this for a year. That's crazy.
It's so crazy.
Coronavirus is here. It is not going anywhere, and the vaccine is now here. So the biggest question on everyone's mind is, do I get it? When do I get it? Should I get it? And what do I have to be worried about?
Yeah. I'm getting these questions all the time too, just because, I was sharing that I'm going to be talking to you and everybody wants to know that. So I think that the best place to start is, okay, I have not had any of my fertility treatments yet. I am just embarking now on the TTC journey. Should I wait to get the vaccine? Because there were the rumors that it causes infertility.
Yep. So that's exactly it. They were rumors. Yes, the absolute best time in, I think, my mind and kind of anyone's mind is you should get it. Coronavirus is not going anywhere. Definitely, it is worth getting the vaccine pre-pregnancy because it's going to protect you. The benefit of this vaccine or any vaccine is it is going to protect you against the virus or coronavirus. And so the biggest worry and what I'm telling my patients is coronavirus is obviously something everyone wants to avoid, especially pregnant women. And so the downfall is pregnant women are extremely more susceptible to coronavirus. And once you're pregnant, you are extremely more at risk of getting sick from coronavirus. So if you can protect yourself against coronavirus, even pre-pregnancy, it's really worth getting the vaccine. The downfall is right now it's really hard to get that vaccine. So if you are young and healthy, you are probably not in that category of getting the vaccine yet. So yes, get the vaccine. But are you in that category where you can get the vaccine yet? Probably not.
Right. That's the struggle. It's like, well, I want to get pregnant in 6 months, but I probably can't get the vaccine for 6 months. So, do I wait to start trying?
Yeah.
Do I delay that even further? Because for so many people, it's like you want a baby. You're like, okay, I want a baby yesterday now. It's like, I'm ready to go. I want to get pregnant next month, next cycle. So I guess that's a big question and a big concern and a big issue is like, do I need to delay getting pregnant now?
I mean, that leads into a whole nother of, obviously fertility of how old are you? Have you been trying? Have you not been trying? But, the key there is definitely consider getting the vaccine pre-pregnancy. American Society of Reproductive Medicine has come out and said, if you are interested in getting pregnant preconceptually, they recommend the vaccine. So our society, the ASRM or American Society of Reproductive Medicine has come out and said preconceptually, if you're looking at getting pregnant, get the vaccine. So really nice to have the society come out behind, you as a physician and say, we recommend the vaccine.
Right.
And then nicely, you slid it in there of, yes, we're concerned about the fertility. And I nicely said, yes, just rumors. But they behind us came out and said, yes, they are rumors. A lot of young, healthy women, very, very concerned about getting the vaccine because they heard the rumors, did due diligence and looked into that, American Society, and I'm going to give you all of that information, and you can put it on the website, and people can have access to that, but have done due diligence and looked into it. But really the theory behind it doesn't hold any truth. The theory is that if the vaccine causes infertility, that COVID would as well, and they have not shown that. But the American Society of Reproductive Medicine came out and showed that it has not been shown to have any validity to it. And the hard part is that there are young, healthy women out there who are in healthcare who have heard this and are concerned about getting the vaccine. And they're the ones who are at the higher risk. They're at high risk of getting COVID. So if they're not getting the vaccine, that's worrisome because they are at risk of getting COVID and getting sick. And so we want to get that word out there that the good news is right now that if you look and I mean, if you type into any web search engine, COVID vaccine and infertility, the first top 3, 5, 10 things that come up are, it is a rumor, look at this. The ASRM, I think, is right up there too of it's not true. So.
Okay, good. All right. So then that moves us into, okay, I am pregnant. This is hard. I mean, different OBs are saying different things. And it's, I mean, again, it's going to be it's a very personal choice, and it's going to really depend on the factors of the person's lifestyle and life in general. But what are these societies saying? And are they saying anything different based on trimester?
Yep. So you pretty much just answered kind of what I'm saying, but I mean, nicely saying it. But the answer is the societies have given out their own recommendations, and any moment in time, you can be getting different answers out there. Different OBs are answering different things. But the first one who came out was Society of Maternal Fetal Medicine and ACOG right in there. ACOG is American College of Obstetrics and Gynecologists. And they both said that they recommend not withholding the vaccine.
Okay.
Which is worded very cautiously, but pretty much saying that they recommend considering getting the vaccine. And I said it very nicely too, considering getting it. I think it depends on your risk level. But it didn't say don't take it, but it said consider taking it, depending. The problem is when the studies were done, both on the two given and currently available within the US, the Pfizer and the Moderna, no studies were done in pregnant women. Although within those studies, some of the women who got the vaccines did end up becoming pregnant. To this point, although they are following them, no complications have existed. The biggest thing, and by no means am I, and here's my disclaimer, I am an OBGYN, I'm a fertility doctor. I am not a specialist in vaccines or infectious disease. But to this point, medical professionals' biggest concerns with vaccines is short-term. Are there reactions to the vaccine immediately? It's not the long-term risk that people are worried about. Are there allergic reactions? So I think the general population is worried about, are there long-term risks? That's not what the medical profession is worried about. It's really not. The idea of this new vaccine, and obviously everyone's out there capable of YouTubing it and looking at what this mRNA is. But mRNA, the reason that it's this new idea of this new vaccine, the virus, whether it be a live virus, a dead virus, or a portion of the virus into the body so that the body is capable of finding that and creating an immune response against it. So what happens is this mRNA is the vector that gets a piece of the protein, or that protein, kind of a portion of that virus, the coronavirus, into the body. And so what happens is the mRNA is the vector that gets it into us. And this is the first of its kind that is able to do it with the mRNA. And so it is this novel, this new idea that can do it. Yes, it's new, but mRNA has existed for over a decade. It's just new for vaccines. And so the cool part of this is it has done it before in other avenues. It's just never done it with viruses before, or sorry, with vaccines before. So it's never done it with viruses for the vaccine before. And so the really, really cool part of it is they have studied it before in other things. They've just never done it with vaccines. And so, yes, it's new, but they said, hey, we know what this virus has. We know that it has this protein. And if we can introduce this protein into the human body, it can create the antibody response to fight it. Really cool. Why does it have to stay at a really, really cold temperature? Because that mRNA degrades really quickly. That's really a good thing, because as soon as it gets into our body, it degrades really quickly. So as long as the person doesn't have an allergic reaction to being exposed to it, which is why they're making people watch and wait and make sure they don't have an allergic response to it, then your body is, hey, it's in there, it replicates, and then you create an immune response to it. And now your body is capable, if you're exposed to coronavirus, to say, hey, I've seen this before. I can fight it off before the coronavirus replicates in your body enough to make you sick. Right. So that's how it works. And it works with the flu when it's a dead virus, and it works with varicella chickenpox when it's a live virus. And that's how vaccines work. So it's not this idea of, oh my gosh, it was this, rapid thing that they had never done before and they created it. It's just, it's the way they created it quick, but for a good reason. We're in a pandemic.
Right.
So go ahead.
I was gonna say, so what about like passing through the placenta and all of that?
So there is no proof that that this mRNA can even make it that long for this. This is just, there's no proof whatsoever. And some of the, one of the articles I showed you specifically, I'm trying to think of looked at that and said, yeah, there has been no studies showing that there has been any mRNA that is capable of making it to the placenta.
Okay.
Which is a good question. I mean, obviously that's what pregnant moms are worried about, of what's this going to do to affect my baby. The good news is that the antibodies that you're making once you get the vaccine are going to be passed to your baby. In theory, it's why we get the whooping cough vaccine when you're pregnant. It's why you can get the flu vaccine to protect yourself against the flu when you're pregnant. I tell women that they give out the flu vaccine like water when you're pregnant to protect you against the flu. And I'd much rather protect myself against coronavirus than get coronavirus when I'm pregnant and be significantly more susceptible and end up in the ICU. We have OB residents rotating with us, and they have women in the ICU and worried about ventilating them and doing emergency C-sections in the ICU. That's not where you want to end up when you're pregnant.
Right. I mean, again, obviously, this information is so helpful to see it from this perspective of like, wow, it can't even last that long to get down to, the placenta. But of course, it's still, it's still your baby, and you still get worried about, again, while mRNA has been around for a while, it is new in this vaccine form. So I think it's just scary to think about. I remember I had hesitation getting Tdap when I was pregnant. I actually didn't with Parker because I had just gotten it before I got pregnant. So they were like, you should be fine because it's within, I don't know, a year or whatever. But I remember being really nervous about it because there's like, they say that there's like heavy metals and toxins in there, and
and you're protecting your baby. But
exactly, it's hard, but that's also to protect your baby. So it's, again, that weighing the cost benefit analysis.
Here's what I'm telling my patients is when you're pregnant, you're more susceptible to coronavirus and to becoming really sick with coronavirus. So World Health Organization, I mean, it's never easy. It's a constant change. World Health Organization last week, which would have been the end of January, so depending when this is posted, end of January, came out and said, we recommend against pregnant women getting the coronavirus vaccine. Very, very hard. Obviously, pregnant women went, oh my gosh, I'm not going to get it. Immediately, Society of Maternal Fetal Medicine and American College of Obstetrics and Gynecologists came out and said, no, we don't agree. We recommend that depending on your risk factors that it should be considered, and still went with their original statement. American Society of Reproductive Medicine has gone as far as saying, we recommend pregnant women get the vaccine. The pushback against World Health Organization very quickly led them to say, so they didn't recommend against it. They said, except in high-risk healthcare workers. They acknowledge that if you are very high risk, that your risk of getting the virus versus your theoretical low risk for the vaccine, it was worth getting the vaccine. But the problem is, as soon as you get pregnant, what's happening? You're going out more. So even if you are in a really low risk situation, if you're in a low risk situation, you're staying inside, you're not going anywhere. Okay, you're not going. I just heard last week, someone who's doing nothing. They're not going anywhere except for grocery shopping. Their spouse isn't going anywhere except for grocery shopping. No one's leaving the house. They still got it. That's it. They still got it. They are going nowhere except for grocery shopping. They got COVID.
Oh, they got COVID. Oh, they didn't get the shot.
They didn't get the shot. They got COVID. Grocery shopping. That's it. They're leaving the house to grocery shop.
Right.
That's it. And so the problem is, as soon as you get pregnant, even if you are going nowhere, not leaving the house, you get pregnant. And what happens? You are, and if you're heading to someone like us for fertility, you're leaving the house for your fertility treatments. You're leaving the house for your inseminations. You're leaving the house and as safe as we are, you're still leaving the house. Mm-hmm. And so the problem becomes you're increasing your risks. And then as soon as you get pregnant, you're leaving the house for your OB visits. You're leaving the house for additional visits. Now, as soon as one partner is leaving the house for a job that is an increased risk, whether it be a teacher, and it may not even be that high risk healthcare worker that World Health Organization was talking about. But if you're working outside of the home, if I just talked to a patient last week who was working at a convenience store type setting, that's an increased risk. But as soon as you're working at an increased risk type setting, a teacher with young kids, anything, you're working at an increased risk type setting, you can't say that you don't have that increased risk. Right. And so the problem becomes, what level is that increased risk acceptable? So yes. Now, what are these theoretical risks of the vaccines? I mean, everyone's going to say we don't know. Why? Because no studies have been done. Now, soon, more data is going to be out there. Why? Because all of these high-risk healthcare workers, guess what? They're getting it. They're getting the vaccine. So shortly, more data is going to be out there because they're getting the vaccine. We're going to show shortly, although a pregnancy does take a while to deliver, but we're going to show that those babies are progressing and they're healthy and everything hopefully looks good. But the problem becomes is that data is going to take a little while. And as these women who have increased risks are looking to get the vaccine, they don't have a lot of information. But the answer becomes, where's your level of comfort? Yeah. And I'm going to tell you that the risk of the vaccine is, from what we can tell, really low. Yeah. We know it's not a live virus. So the risk of getting the virus from the vaccine, it doesn't exist. Is there a risk of the mRNA? No, it degrades really quickly. Is there a risk of getting a fever vaccine? Yes, we know that. It's low, depending, and we're showing more and more with the second dose, it's a little higher, possibly because it's your immune response. And so American College of Obstetrics and Gynecologists, I know they clearly, I think when they sent out their bulletin said, hey, if you're pregnant and you get a fever, take Tylenol to bump that fever down. Why? We know we don't want pregnant women to have a fever, especially if they're in the first trimester. So bump that fever down, but that's the same as if you were to get sick. Right. And have an upper respiratory infection or have influenza. Now, which would I rather? Would I rather have you have the vaccine and have a fever for 12 or 24 hours and bump that fever down? Or would I rather you have COVID and have a fever for a prolonged period of time and be really sick? Right. I mean, that's an easy answer. I'd rather you get the vaccine and be protected versus have a prolonged fever and get really sick with COVID.
Right. Oh, yeah.
I know. Now, here's the other problem is COVID, forget just the fever that COVID causes. COVID causes other significant things that we've learned over this last year since that first patient who had COVID. COVID causes increased risk of blood clots. COVID causes other significant, and they're showing more and more long-term, but the blood clots scares me. Blood clots with pregnancy does not mix well. So COVID causes increased risk of blood clots, which causes increased risk of miscarriages, increased risk of pregnancy loss, even if it's not in that first trimester. So there's increased risk of loss of pregnancy in general. Increased risk of pregnancy complications, early delivery, and that's not anything to mess around with in relation to pregnancy. So it is complications with pregnancy. So you don't want to get COVID when you're pregnant, period. You don't want to get it. Stay safe, wear your mask, wash your hands, stay away from sick people, right. Tell others around you to get their vaccines.
Right. No, this is really helpful. And I will share all the links that you had sent to me. And again, this is we are recording this on February 4th, 2021. Things could change tomorrow, but as of today, this is what they're saying. And I, share these links with you guys, and you make the informed decision with your specific doctor and what feels.
You have to do what's right for you. No question. I mean, only you can decide what's right for you and your pregnancy and your body. But the answer is it's a risk versus benefit. And the risk of COVID is real. We know it's out there. And if you are out there in your community, you're at risk of getting COVID. And pre-pregnancy, I would say strongly consider the vaccine. There is a reason, we're in Pennsylvania right now. There is a reason that pregnant patients have become a category 1A in Pennsylvania because they become a high-risk population. So pregnant patients are capable of getting the vaccine.
Right. Thank you for sharing your wisdom. Show everyone your shirt.
So I am vaccinated as a healthcare worker, seeing patients, but I am also crafty, and I am very, very proud that I am vaccinated. So it says going down, it says COVID vaccinated, and then it's all the other vaccines that we all get. We all get them when we're kids. Vaccinated. It's worth considering.
Yeah. Thank you for your time. Good luck,
Thanks,
everyone.
Guys. Stay safe out there.
I know.